Assalamu alaikum, Ultra Scan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right and lower left 8 and their relationship with the inferior alveolar nerve. Moving to the lower right 8 first, this is the mesial aspect on the transaxial view, which is basically the proximal view. Now here very clearly you can see that where the mesial root is approximately 6 millimeters away from the nerve, and as we move in the interradicular area, something to be noted is that there is a radix intermoralis. So we've got two distal roots, a radix intermoralis on the buccal aspect right here, not on the lingual, and then we've got the distal root right here. The distal root is approximately 4 millimeters away from the nerve. So this tooth definitely is well away from the inferior alveolar nerve, and there's no chance of nerve damage provided that the guttering is not done very deep, where we have sufficient bone on the buccal side for guttering, and the inferior alveolar nerve is inferiorly, not buccally or lingually. Now moving to the lower left 8, and this is the lower left 8, and as you can very clearly see, this is the mesial aspect of the lower left 8. It's very closely associated with the roots of the lower left 7. So the lower left 8 mesial root is right here. We're approximately 5 millimeters away there. And then when we move to the distal root, again, two roots here, radix intermoralis and a distal root. So this here is significantly close. So we're approximately 3 millimeters from the apex. So the lower left 8 is going to be slightly tricky for extraction because of its close proximity, even though it's not looping or in contact with the inferior alveolar nerve, but it is very closely in proximation. We just wanted to show you the sagittal view so that you can understand the relationship between the mesial root of the 8 and the distal root of the 7 right here. There we go, this part here. So this is the area which needs to be kept in mind because the extraction of the 8 is going to be significantly difficult. Sorry. My apologies. But this is how you can see that we are close on the left hand side, but we're well aware and clear for extraction, and the risk of damage is minimal in this case. Thank you very much.